1 second. I just want to just get the right presentation here. Good. Morgan's friend, do you see the one I have up? Why don't I not see? Oh yeah, I see it. Hold on.
Yeah,
Yeah, I see.
I can
Good,
see it.
good, good. Welcome to an episode of Dentist Job Connect TV. I'm here with an amazing dentisting human you're going to meet here in just a second. At Dentist Job Connect, we strive to bond dentists together to share in the joy of full contact arts and crafts. Some people who don't want to be there pay for it. That's how I describe dentisting. If you would like help from us, please reach out to us at dentistjobconnect.com. So I'd like my guest to introduce himself. Could you share with our audience who you are and what you do in your daily dentisting day?
Hey guys, my name is Dr. Rehan Shahid. I am the CEO and founder of Shahid Dental Group. It's a couple of practices in Northeast Texas. We have 4 practices currently and even a dental assistant school. So right now I still practice a couple days a week, and then I kind of serve as a leadership role in
4 practices and a dental assistant group. Rehan, tell us, when did you graduate from dental school?
I'm a COVID grad, so I'm the 2020 graduate that got chipped off.
2020 grad. So in just 4 years, you bought 4 practices, dental assisting school. You said you've been someone who followed dental nachos since dental school. You know, we have dentists of all ages and stages, dental students. How did dental nachos help you as a dental student? Whether it made you feel more connected, made you think, wow, this world is crazier than I thought, all of those things and more. Tell us about that.
Yeah, Paul, I mean, honestly, it showed you the real world of dentistry beyond school, right? School, you're taught all these lectures, and you were one of the groups out there that just showed, hey, this is what the real dentistry looks like.
I love that. It's totally exactly what I'm going for. One of the things that I think is, and I never thought of it until this moment, Rehan, it's like if you're in 2nd grade, you have all the way till graduating from high school to get the real world, right? But dental school, the real world comes at you fast. Day 1 of D1 to going into the real world, it's pretty quick time. And I think it's key that you're paying attention to what happens outside of dental school, because people like to think I criticize dental schools, which I do. I'll also compliment them because it's not easy to do what they do. But all of those things together, Rehan, I always share, if you practice like you did in dental school, you would go out of business immediately. You couldn't possibly spend that much time on one procedure. It's important to learn it well, but it's also important to learn it in a way that you can deliver it in the real world. So as we kind of go through your story, tell us about what inspired you to become a multiple practice owner.
Yeah, so in dental school, I would always see everyone studying hardcore for a test, and I was just like, I'll study for the test, but none of that's really helping me in the real world out there. Definitely not helping me make money and support a lifestyle that I want that supports my family. And so my priority was, I'm going to study here, but my main priority is talk to people that are actually living in the real world and get advice from them. And constant feedback that I would get is, hey, go shadow a dentist, go learn from the people that are actually doing what you want to do. And so early on, I shadowed a couple of amazing people, and they showed me what the real world was like, and they gave me the best advice, which was, focus on school, but focus on what really is out there first.
I want to please, Nacho team, pull out that gold, because Rehan, this is from 8:35 a.m. Hey, Dr. Goodman, I just started my D2 year. I might want to specialize in OMS. I might want to do pros or perio. I might also want to do general dentistry. My goal is to be as competent as possible. What should I do? And my 2 points, Rehan, is 1, take as much additional real world CE while keeping your grades up. And 2, go shadow a periodontist, an oral surgeon, and a GP. It's wild to me, Rehan, that these people are making decisions for the rest of their life based on dental school, where they don't get context. You and your brother are both practicing dentists. How did you find those dentists to shadow?
I really if you just go to Google Maps and you look up the nearest dentist, almost every dentist will be open to having you come out there. It's crazy. We live in this bubble thinking people don't want to help, but every dentist that I know, if you just call them, they'll say, hey, I'm happy to show you anything you want me to show you.
Yeah, right. Because dentists, interestingly, in small groups are amazing. Sometimes in large groups, they are not as amazing. But I really admire anyone who owns more than one dental practice, because I say running dental practice is like running circuses where the animals don't try to eat you, just slowly annoy you to death. So I think
Yeah.
it's awesome that you have this 4 office group. What is the mission, vision, and core values of your dental group?
So our vision is to be able to just help serve our Northeast Texas area at the best we can through most comprehensive care, while also having a rock star team that makes the most money, has the most amazing lifestyle, doing what they love. Our core values are actually my last name, so Shahid, which is service, humbleness, always improving, honesty, integrity, and drive.
Love
So
that. That's awesome. We'll put that. I mean, I love the acronyms, as you know, from my JBNs and ABCs and TSD stuff. And I think it's so key because in the day to day of running any company, but especially a dental office, it's easy to lose sight of why you're there. And let me explain why, Rehan, because the patients are very annoying. And I say it in a loving way, but people come into your dental office who open up conversations with, I just want to let you know I hate the dentist. And I want to say to them, I just want to let you know you could have kept that in your head. So I share this in the most authentic way as someone who does dental nachos, dentist job connect, 2 dental practices, and have been involved in organizations. I've never seen a more adversarial customer relationship, patient relationship than the dentist and the patients and team. So for your teams, it can be really stressful to deal with that every day. How do you guys manage that? How does your team stay positive in the face of what does my insurance cover? I just want to let you know I hate the dentist. Are we going to be done soon?
I think for us, it's just really reflecting on one of our core values, humbleness. It's remembering where we come from, what we're here to do, and how we're here to do it. So when you reflect on that, and what we as a team do, we reflect on it weekly. It allows you to kind of connect right back into why are we doing what we're doing in the first place. And we're also a business. We're not just hoorah and help people. It's also do that, but then also create an opportunity for you to be able to support your family at the same time. So finding the perfect balance of, why are we doing what we're doing, and reflecting that to ourselves.
I love that. I mean, it's some of those patients who start off in the angry, yelly way, they can be transformed into your biggest fans. They have problems with dentistry that have nothing to do with you. The problem is when it's in your face, it feels like it has a lot to do with you. And
Yeah.
you've touched on a topic, you can kind of wrap this into the importance of communication, but dental school doesn't talk about making money. But what I share is my mission, vision, core values in all my companies is if it doesn't help, it doesn't matter. Be proud to share and sell that help. If it doesn't help, it doesn't matter. If it helps, implant overdentures, job connect, be so proud to share and sell it. But dental school makes us feel weird about money. Why do you think that is? And how in your organizations do you take pride in helping patients and being productive along the way?
So I think in dental school, you don't have to worry about patient satisfaction because you
Yeah.
get a patient already lined up for you that you had to not really try and getting in the chair. And it's kind of like everything's done for you. In a real world setting, you actually have to really try to impress a patient through
Great
marketing
point.
funnels and getting them in the chair. And then you have to be a very good communicator and show the patient the value on your recommended treatment. And so you're constantly selling your own self, so to speak, versus dental school, you're kind of, hey, patient shows up with insurance, you do what you do for some credit and you're done. You never see the patient again.
Yeah,
Uh,
that's actually I've never totally thought of it that way. I think it's really brilliant the way you put it. And I kind of say like you're not in charge of the dental school staying in business, right? You're not in charge of the dental school staying in business. And it's such an important point. And as we talk about communication, so I do Super Dentist Boost Camp. I want to kindly encourage you and your brother to come sometime. And
yeah.
last year at the end of Super Dentist Boost Camp, we had 3 full days, money, management, not crying inside, clinical stuff. And I said to Dr. Christian Mullen, he can be tagged. He's a DSI and DSN, or another guy who's used Job Connect, grown his practice. I said, what was something you're going to take away? And he said, it was the 5 sentences you say to new patients, Paul. And I'll tell you these 5 sentences, and you're welcome to use them in your organization. So I do consults on people who haven't been to the dentist, Rehan. They're embarrassed. And I got to walk in and I got to say something, right? And I don't ask them what's their chief complaint. I don't ask them about gout. I want to create a relationship. So I say the same 5 sentences every time. Hi, my name is Dr. Paul. I'm so glad that you are here. Coming to the dentist is not everyone's favorite place. So be proud of yourself for being here today. And I have one question for you. During this appointment, what is one thing I can do to make you happier? And then I pause. They usually laugh or smile. They don't think of happiness at the dentist. But what they say next is gold. I'm embarrassed to eat at my grandchildren's school. I'm worried I'm going to get infection. I'm upset my dentures move around. And he said that was his biggest takeaway from Boost Camp. And you touched on with communication, but how do you train your associates? How do you train your team? What do you guys do to communicate with your patients?
For us, I think like what you said, Paul, when you're trying to train someone to be good, they have to know what good is first. So what you said, I mean, I think that's amazing. Having a certain guidelines to help make it easy for a new doctor that's never really
Yeah.
talked to patients that they have to depend on. Number two is really being a good listener.
Yeah.
I like to say, God made us with 2 ears and one mouth, so we need to
Yeah.
listen more and not talk as much. And so when you're actually able to listen to the patient, like with you asking the questions and pausing, and dentists love to talk. It's crazy.
Yeah.
They never like shut up and listen to the patient. When the patient starts talking, like you said, it's gold. Like listen and then
Yeah.
target every single thing that they're mentioning, and boom, you're not giving the patient what they wanted, and it's making you money, and you're helping people. It's like it's the best of everything.
And I'll share, hopefully some people get some value out of this. When you guys come to Philadelphia and say, hey, Paul, where should I go get nachos? I will say, hey, guys, you want to go to Elvez or Mission. Those are two great restaurants. They're in walking distance of the hotel, and both of them have nachos that will make you happy. 4 sentences. When people say this, and a lot of times it's because they're not confident in their head, you could go to 10th Street or you could try this other place. There's a good place over here. The more words you say, the less confident you seem. It may or may not be the reality. But it's so key for you to work on your words, just like you work on prepping a crown or bonding in a veneer. And I think because dentists don't do that, they, in a lot of ways, and I'd say they suffer throughout their careers.
Mm-hmm. I agree.
Um,
Uh,
Tell me next about multi-practice owners, right? I'm one, you have more practice than me. They think multi-practice owners, you're so rich and you make so much money and it's so easy for you. Tell us about some of the challenges. Someone saying, I want to be like these brothers. I want to own multiple practices. You say, hey, that's great. And you better be ready for this. And you better watch out for this. And this. Tell us some of those challenges.
so I think the biggest challenge is having a bunch of people that look up to you, and if you can't really do well in one practice, it makes the other practices
Yeah.
harder because you're only replicating that problem times however many practices you have.
Yes.
But then your attention really goes to the practice you work in, if that makes sense. So um, originally, when we had two practices, practice one was amazing because we were there. Practice two started suffering because we realized, hey, we are the ones that are making the practices work. And that's when we had to realize we have to step away enough to train replications of ourselves to see, can we now make other practices successful. And there's a quote that I like by Dan Martell. He says, having someone do something 100% will result in you doing it like 80. Let me backtrack.
Yes.
Having someone do something 100% themselves, and it'll give you the result of 80% because you would have done it better. It's still 100% awesome because you didn't do any of it.
I couldn't agree more. I could give you a hug through this Zoom for that. I mean, here's the thing about dentistry. It's amazing, but also in some ways, I don't know if I want to say awful, but many times for most dentists, year 3 is no different than year 43. And if that's their vision, that's okay. But most CEOs of companies don't do 15 buckles their whole career. And it's not a judgment. It's just as for hopefully inspiring some people. Unless you get people around you who you can delegate, who you can train, you are going to be 61 years old at 10 a.m. doing a 15 buckle on a patient. And if that's what you want to do and makes you happy, go ahead and do it. But I found in selling practices, that's some of the biggest frustrations for dentists 20, 30 years in, that they are still doing the same thing they did when they started. You do some coaching, you have some programs. Have you seen that pain point for dentists?
Yeah, I mean, I think so. Every dentist graduates and wants this associate-driven model, and they get to sit back on a couch and enjoy life. What happens is they never learn the skill of delegation, and so they are, for a lot of offices, they're glorified office managers, and the dentist really ends up being that glorified office manager running the show. But if they take a day off, it's like the office just crashes.
Yeah.
And that's there's no leadership there. There's no delegation. And so that's the number one thing I tell people. It's like, hey, if you had to go away for this 3 month thing, would your office burn? And if the
Yeah.
answer is yes, that tells you what you need to focus on.
I,
Replicate yourself.
I love that. Now we'll talk about the rewards. So yesterday, uh, sometimes you don't see how awesome your own kids are because inside of your own house, they can be quite difficult. I don't know if you've noticed that about kids, but we were at a party yesterday on a rooftop and someone said, your older daughter's just so amazing, the way she is with the younger kids and the way she, and that was a really nice compliment for me to get. So that was the reward of multi-kid having, right? I have two children, and that was the reward. There's a lot of stress, there's a lot of energy, but that was a reward. Sitting on a rooftop at a party, having other parents say how great she was. Tell us one of the rewards of owning multiple practices. You told us the stress, but what about the success? What drives you? What makes you feel good like that?
I think my personal vision was to impact the most people. And a lot of people think you have to be the dentist forever to do that. And in reality, if I have multiple practices, I'm impacting even more people through them. And so one of my biggest rewards is I get to serve, 4 times as much as people without me physically being the one that does it, but
Love
because I
that.
have a hand in that. So I get to make a bigger impact in the world than I would have been able to do by myself.
We've definitely got to pull out. That's awesome. And I feel the same way. And that's when I encourage dentists to think about associates. I mean, if you are the customer of a one-person band in anything, from the person who cuts your hair or does your teeth, there's certain vulnerabilities because if they're on vacation, you can't get help from their organization. So we are going on vacation as two brothers in July, and our organization is there for the patients. They can deal with emergencies, they can see people. It's not to knock the solo dentist, it's just to explain that patients who only think of you as the only person who can do things for them in their life, it becomes a lot of pressure over time and you won't take as many vacations or you might not take off for this. So now as we wrap up, we are here with Dentist Job Connect. We've helped you in the past. We're helping you again. What does your organization look for in an associate?
For us, it's really personality and ambition. So it's hard to train personality and it's hard to train ambition. I can train every skill set that exists. So, sucky dentist, I can train you to be better
Yeah.
clinically, but I cannot train your internal desire to succeed. And that's what I look for because if you're passionate or you have ambition and drive, you're going to succeed because you're going to want me to train you more and more, or you're going to take courses. We have I've seen some associates that won't take any CE course beyond the 12 hours that they need to maintain their license, and they're expecting to get better, right?
Yeah.
And you physically can't get better if it's a passive approach. You have to be active, whether it's a physical CE course or doing some online courses, like for example, that you host, Paul. Something is better actively than sitting back passively and expecting to get better.
And one of the things it's like that Wizard of Oz at the end, they said the answer was inside of you all along. I say this to associates. It's so they make their life better. When I work with Dr. Lincoln Harris, it's so when they walk into the operatory, they feel more confident. They feel more confident. They have more fun. If you think of CE or growth as a penalty or like homework, you're not the right fit for my organization either, because I want you to walk into an operatory and do the best job you can do. Like you said, I love that 80% thing. And I think that mindset, I mean, you're 4 years, 3 years out of dental school, and you guys have that. Now, tell us about the type of associate dentist. Do you hire out of school with experience, a combination of both? Tell us more about those details.
I think for us, it's a combination of both. I think you can when you hire a new grad, they have this internal desire to learn everything, which is something that we really love, and that's kind of what attracts us to new grads that we are able to mold
Yeah.
still. They haven't been burnt out by
Yeah.
a corporate practice, let's say, or something in that realm. But then also, people that have the skill set that still have that internal desire to grow. That's always a plus side because now they have the experience under their belt to be able to bring more skill sets to the table. And so we actually look for a combination of both. But going back to what I said, passion, drive, ambition, personality, those are the things I look for more than skill set.
And one of the things I hope people listening, even my team listening, this isn't a dentistry thing. And this is a quote I like. I don't know if I made it up or, but like, no habits are better than bad habits. No habits are better than bad habits. So whether it's the person who answers your phone or assists the dentist or is your client services director, is your associate, if they've developed bad habits over the years with their experience, unlearning bad habits to me is one of the most challenging and sometimes impossible things to do. So I like your attitude towards the learning mindset, but also if people have good experience, that's awesome, right? Like we have a
Sure.
sales director for Dentist Job Connect who brought all our awesome experience here and is now sharing that with the whole team. So I think that's great. So as we wrap up, tell us what you need now. If people are watching this 3 years from now, it might be a little different. We have your text code, or how do I say this here? Gladewater?
Yeah, Glade Water.
Right. So people can text Gladewater to 215-798-9897 to get connected and apply for your job. Tell us about what you're looking for right now. If someone's listening and thinking, I want to apply with this group, tell us about those positions.
Well, depending on who is listening and when they're listening, we're always looking for a new doctor. I never know what level of growth we're at. So, in Northeast Texas, about 2 hours from Dallas, we're always looking for new doctors that are ready to just tackle the world and be successful through amazing mentorship and guidance of wanting to be the best you can be. Currently, at this moment in time, we're looking for two doctors, one in Gladewater, Texas, and then another in Mount Pleasant, Texas. So two associates, and depending on when you're watching, we might be even looking for more.
Awesome, man. And people can reach out to us at dentistjobconnect.com. We love working with you and your brother. You guys are amazing role models. I was watching TikTok and they say we should change how we talk to our children and team. And I want to say this to you. Instead of saying, I'm so proud of you, we should say you should be so proud of yourself. And what you guys have created, you should be so proud of. You're creating a home for dentists. You're helping more patients. You totally get the Nacho and Dentist Job Connect mission, vision of core values of always be connecting, always be caring. Before we wrap up, Dr. Rehan, anything else you'd like to share with our audience?
I mean, I appreciate you having me, Paul. And for anyone that's watching that's just trying to get their feet wet, I guess, you know, I've known Paul since I was in dental school. And I like to say, there's a quote, we stand on the shoulders of giants. I'm not here by myself. I'm here with, the grace of God, the grace of people like Paul who are
Thanks.
doing what they're doing out there to be able to give me the advantage of I'm learning from people like him and getting better every day. And so, thanks for giving me an opportunity to even be here, but also thanks for a part of my life that you serve to make me get to my next step.
Well, I truly